I am Mary Cordova, one of the co-founders of Concierge Care Advisors. We help seniors find care for in-home care or a transition. I'm here with our Physician Advisory Board, Dr. Brian Ferris and Dr. Alex D. Moraes.
Thank you. It's great to be here.
Thank you for
Thanks
coming.
for asking us.
Thank you. You guys are physicians. If you end up in the hospital, like you might have recently, doctor, on your accident, and I'll let you talk about that if you would like, but you probably felt much better once you arrived home and got in your own bed. I think anytime we're in the hospital, we feel better once we're home.
Yeah, it was really interesting. You're referring to my bicycle crash, which happened 9 days ago,
Okay.
and actually was compounded, no compound fractures, thank goodness, but compounded by being out of the country. And just being to the north, it's still a border. And the care was fantastic. I felt great. And to be fair, the person I really felt I needed to talk to in the big picture was the case manager.
Oh.
Because I'm thinking, okay, I've gotten great care, I've gotten the immediacy,
Right away.
but my records, my films, how am I going to get out of here?
Right.
And she was fantastic.
Wonderful.
And helped answer a lot of those questions. Even in an acute need, that was really hard on my wife, most importantly, who was there. And I've fortunately had a great support network to get through it, but it was a lot of work, a lot of work.
And we can take the burden off of the families. When families are going through those crises or navigating.
Could I have called?
You should have called. And then you know what? Your wife wouldn't have been involved. You would have been just sitting there sipping your iced tea in your hospital bed, and we would have managed everything.
It's Canada. I got hot tea.
Oh, you got hot tea. That's right. But that's what we're there for, and we can help navigate. And a lot of times the seniors are given, like you said, a long-term care facility, and that facility may be for an 85-year-old female that has her husband 60 miles away.
Yeah, but we were having my wife and I were having the conversation, early on for the first couple post-operative days. Post-op, after surgery, post-op day 1 starts the day after surgery. And for me, post-op day 0 was great because the surgeon put a lot of regional, we call a field block of longer acting anesthetic. I felt great. Then reality came the following morning.
I would imagine.
And we really talked seriously that I may have to go for post-discharge rehabilitative care, or what's called inpatient rehab, or maybe subacute rehab in a skilled nursing facility. It was a very real conversation. And even though we both have experience working in the system, it was a huge mountain to face. And fortunately, I didn't have to climb it, and I was able to get home. But yes, it was like, where's my case manager?
Right. And can you imagine being in the hospital at 85?
Well, or not knowing the system.
And not knowing the system,
Yeah.
Right. And an 85-year-old, wife, she's in crisis. Her husband's laying in the hospital bed, got some bad news.
Right.
And now she's like, okay, what next?
And then their supplement says, we'll get on the app.
Right. And then
and he or she says, app.
yeah, what's that? Right? Yeah.
And the insurance companies are not useful. It's so much pushback that typically when you have somebody and you call, you're really your own advocate to try to get any kind of service from them, whether it be placement, transportation, something as simple as a wheelchair.
Right.
It's a mountain to climb. You have to get a note from a doctor. And it has to be sometimes certified, and there's days to get those. So it's nice to know that you've got somebody on your team.
Doctor, do you think durable medical equipment may be the best kept secret? Because we run into that quite a bit, even for people that on hospital beds and wheelchairs that don't understand. You don't have to buy your first wheelchair. If you're a Medicare, we will, get that covered for you.
It's not. They don't want to talk about it because they don't want to pay for it.
Okay.
So if you truly have a need, yes, you should have a conversation with your physician. You can get a note.
Mm-hmm.
You take that to every place has, they call them DME, durable
Right.
medical equipment. There are a lot of facilities that provide DME, and as long as they have the documentation, I always ask people when you're getting DME, be patient, because my letter is just the beginning of the process.
Mm-hmm.
There are some DME companies that are really great. They'll fill out all the forms, and the physician typically signs it. But sometimes it's like climbing. It's like the treadmaster at the gym. No matter how fast you climb it, you never get to the top.
Right.
So
Right.
it's hard.
There's sometimes we'll advise people to go ahead and just pay for 1 month private pay on a hospital bed versus getting the extra charges of staying at a skilled nursing center
Yes.
if they can't get that through insurance quickly.
I think it's context. I think that, for example, with hospice services, they are such a DME is integral to what they do.
Yes.
They're very, very quick.
Yes, they are.
I
Yeah.
think in other cases it's more complicated, and I think the story. Let me back up. I think that the smiles that we're generating is rooted in the history of the story, and that DME's probably had some problems in the past with whether it's abuse or fraud, or or anything in between. And so it's a process that has been sort of scotch taped and stapled and bubble gummed to get it together, and it's clearly in need of doing better.
Yeah.
Because it can make things a lot easier when applied properly.
Absolutely agreed. Anything else on that subject as far as durable medical equipment that you guys feel challenged from your side?
I think it's use. I think it's a complicated system, and when you're ill, when you're of advanced age, or if you have any fear, challenge, whatever barrier there is to navigating the system, your chances of success are lower. It's that simple.
Yep.
And then that means that you don't do as well.
Right.
And so I think that we make a lot of assumptions on what could be done. And I think that if you all are taking that on to help advocate for that, that's just a tremendous amount of added value to support. Because what does it mean? Durable medical equipment. So it's durable to help somebody with whatever goal, whether it's they're climbing a mountain, it's a transient challenge, or it's a long-term challenge. So I think it's a huge thing to consider.
That goes with even things like CPAP.
Right, right.
People do have medical needs. And if you obviously have obstructive sleep apnea, after a certain period of time, those devices decay, and there is a replacement process. My wish would be that people would look at what their insurance furnishes, and then when they come to a visit, bring that data with them. Because I can't tell you, I write for a wheelchair, then I get something back that says only these wheelchairs are covered.
Exactly.
So now I have to have another conversation with the family. Because I'll write a wheelchair, and then they'll say, well, I don't like that wheelchair, can I have this one?
Right.
So now 2 weeks, 3 weeks have gone by. And that's the same thing that occurs with wheelchairs, walkers, CPAP machines.
Well,
there's a number of...
Well, for this population they're on Medicare, they get their Medicare supplement, then there's the multiple levels. I think they use the letter of the alphabet to determine the depth of coverage. And then there's a bunch of companies competing for that, and then you throw the Med Advantage into that. And they're all selling a product, right? The issue is, how do you get the information? Let me see the catalog, right? How do we make this accessible as one-click online shopping, right? Where I can see what you can have. Oh, okay, well, my idea is that you would get product A. Your plan, you're not going to get product A because your plan puts us B through D. Now let's solve the problem. And I think people, once they know that, once there's that transparency, I think that they're just like anything else, they're going to be more able to adapt and understand and get past again, the surprise, the shock, the anger, which serves nobody.
Right.
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 And so if there's a way to get that information, get it quickly, that would be very helpful.
Well, I have an advantage there because I come from the DME world and I kind of know the background of getting the doctor the prescription, know what you need on your diagnosis for a hospital bed, the wheelchair, the tilt back wheelchairs.
Are we in gotcha territory? Did we
We're
do
in
something
gotcha,
wrong?
no,
Okay.
not at all. But also,
Bait and switch.
yeah. But also, I find that with Hoyers, I'll have my staff members come to me and do case management, and they'll say, "Well, the family needs to buy a Hoyer," and it's like, no, anyone that isn't bearing weight, obviously, and they're over the Medicare age, they'll be able to get the Hoyer. I promise you.
Families suffer so much
They
by
do. The lack of education and understanding, or they'll say the provider, which is a little bit scary, says that there's already a Hoyer in the house and they can share it. And I say, well, wonderful. If there's a fire, who gets the Hoyer? Right?
Oh, well
so
said.
We know everybody that is non-ambulatory needs a Hoyer, right? So that's also covered by Medicare dollars, as we know. But as you said, doctor, they all need an advocate. This takes years and years of knowledge to understand. I've been in the industry of, on this side of transitional care for about 20 years, and I learn something new every day. So it is very complex, and very complex for seniors and their adult children and spouses to be able to navigate. So thank you again so much for coming today. We really appreciate your time.
It was cool.
Yeah.
Thank you.
Thanks for what you do.
Yeah.
Yeah.